In 1989, South Korea's government mandated universal health care, which they call it national health insurance. In the first year of adopting national health insurance, South Korea showed a remarkable performance with no signs of financial instability. However, in 1997, during the economic crisis throughout Southeast Asia, South Korea's funding began to experience financial deficits, and this caused a disruption of healthcare services. The financial structure of national health insurance in Korea became disorganized when they separate pharmaceutical services and payment of medical services in the year 2000. And even when Korean government have continued to raise the premiums on mandatory insurance to try to offset the healthcare deficit, Korean healthcare policy still anticipate that the current funding would not truly resolve the problem. All citizens of South Korea are eligible for health insurance coverage under national health insurance. Korea also have medical aid program that was established in 1979 to cover low-income families, and the government also cover all medical expenses for individuals who are unable to pay for their healthcare service. They also have long-term care insurance, and that is funded by the government subsidies, contribution paid by the insured public, and the co-payments of the beneficiaries. In South Korea's healthcare insurance program structure, they are divided into four parts, which is the Ministry of Health, HIRA, National Health Insurance, and the Medicare Institution. Patients in South Korea have the freedom of choice to go any medical institutions, doctors, hospitals of their choice. However, there is a referral arrangement that they need to do for them to see a specialist. And in America, we call it gatekeeper. Gatekeepers are medical practitioners who first diagnose their patients, and they could issue a referral to the patient for them to see a specialist of their choice. The quality of healthcare in South Korea is that it is still ongoing changes towards the improvement of the quality of care. And at the medical providers level, the quality of care is often driven by motivated medical professionals that are determined to adhere to their beliefs and providing highest quality of care to their patients. Also, policymakers have responsibilities in the improvement of healthcare, and in that aspect, they often struggle in prioritizing over major objectives that they have. Proposals that policymakers came up is to develop monitoring system for every clinician, and this is to measure and identify clinical breaches in the patient's safety. And also, Korean patients have means to provide feedback of their encounter and the quality of care services that they receive. The healthcare costs in South Korea. Patients in South Korea have ultimate freedom of choice to either choose Oriental or Western medicine, and medical providers are being paid by fee for service of all the healthcare services that they provide to their patient. And National Health Insurance Review Agency are responsible for reviewing the claim that the providers submitted for reimbursement. And Korean citizens who traveled abroad, they are required to get travel insurance because medical costs outside Korea is not covered by national health insurance. In this slide, this is the Korea's payment mechanism. It includes healthcare services, out of pocket, and other protection mechanism that goes with it.